dorsiflexion range of motion had a statistically significant effect on plantar fasciitis risk, with each 1 degree loss of dorsiflexion of active range of motion increasing the risk of plantar fasciitis by 14.6%. So, they're just correlating those things together. So then the other two that I mentioned earlier were Achilles tendinopathies and medial tibial stress syndrome. So how does Aquinas factor into those? Becker looked at this. So he had groups of patients with Achilles tendinopathies and groups of patients with medial tibial stress syndrome. And then they had matched controls for each group. And basically what they showed was there was a significant relationship in both groups with how tight their calf muscle was. And then also the standing tibial varus angle. Those were the two things that were statistically significantly different between the groups with tendinopathy or medial tibial stress syndrome compared with their respective match controls. And that's kind of what they said in their conclusion, that lack of static ankle joint dorsiflexion is predictive of developing both medial tibial stress syndrome and Achilles tendinopathies. One thing about Achilles tendinopathies, and whenever I talk about this slide in particular, I always think of Kobe Bryant. He was never my favorite player, but I just think that I think personally, Kobe Bryant's Achilles tendon rupture could have been prevented. I think most Achilles tendon ruptures can be prevented with appropriate preventative care.